I want to begin by thanking the 21st Century Council for their health agenda, because it's very much in sync with what we got done in the Patient Protection and Affordable Care Act and the Health and Education Reconciliation Act. And to thank those of you who raised your hand who were here last year, because the interaction that we had as we were just discussing what was in the House bill and what was perhaps going to be in the Senate bill really helped to guide us as we went back to work and helped to influence the final product. If you remember, we started with two basic principles as we started with two basic principles as a CBC and eventually as a tri-caucus, because the Congressional Black Caucus worked very closely with the Hispanic and Asian Pacific Caucus in developing the principles that guided us as we went through this process and setting the benchmarks that we sought to meet. The two principles were basically that insurance is not enough for our community. While having everyone covered is critical and provides that access that everyone needs, in our communities, lack of insurance accounts for only about 20% of health disparities. So one of the things that guided us was that insurance is not enough. We had to make sure that this bill went further. And the second principle was that eliminating health disparities had to be a core part of the entire process. And I think we were very successful in doing that. You will find that not only is health disparities defined within the legislation, but every commission, every research project, every task force has as one of its goals the eliminating of health disparities. There's data collection that will be mandated by any program that gets federal funding to include racial and ethnic data, gender data, geographical data, and all socioeconomic data, which is not consistently done throughout Health and Human Services right now. And that's not only collecting the data, but analyzing the data and reporting the data. So we feel that we really accomplished. We started out with about 12 benchmarks, and we accomplished pretty much all of them. And I'm going to really let my panel, which is a really great panel that I have. I'm really very honored to be able to moderate the folks that are up here with me this morning. I'm going to let them explain different issues and provisions in the legislation. And at the end, I will fill in anything that we feel may not have been covered adequately, and then we'll allow you to ask some questions. The process is really at the very beginning. Implementation is where the devil is going to be in the details. On Monday, we're convening what we are calling the Health Equity Leadership Council, which is a group of about 12 people who are going to monitor the implementation of healthcare reform, particularly with the provisions that we were able to include that specifically speak to eliminating health disparities in racial and ethnic minorities, poor and rural communities. My panel this morning includes, and we really didn't have a chance to go over the order, but we're going to start with Barbetta Singletary. And she currently serves as one of the highest-ranking healthcare advisors and is the first African-American woman and the only African-American policy director in the leadership of the U.S. House of Representatives. In this capacity, she is responsible for drafting, analyzing, directing, and advising the Majority Whip, Jim Clyburn, on legislative priorities before the House. She is directly responsible for for us actually getting done what we set out to get done, because she was at all of the important meetings of leadership both in the House, the Senate, and the White House. And I'm going to let her tell you about some of the particular areas that she played a key role in including in the Affordable Care Act and the Healthcare and Education Reconciliation Act. We also have with us, I'm going to do all of the introductions at one time. We also have with us Catherine Alicia Georges. When I saw the Catherine, I told my health policy staffer that she had your name wrong, Alicia. But Alicia is currently a member of the board of directors of AARP. She's a member of the Audit and Finance Committee and the National Policy Council at AARP. She's also president of the National Black Nurses Association. Her career spans more than 3 decades as a nurse educator and leader in efforts to eliminate health disparities and improve the health of minorities and the disadvantaged. Also with us is Dr. Warren Jones, who's a family physician and a retired captain in the U.S. Navy. He is the founding executive director of the Mississippi Institute for Improvement of Geographic Minority Health at the University of Mississippi Medical Center, and a professor of family medicine, a distinguished professor of health policy, and a senior health policy advisor and professor of anesthesiology. He was most recently executive director of the Division of Medicaid in the Office of the Governor of Mississippi, and he is a past president of the American Academy of Family Physicians. My colleague who is with us this morning is Congressman Robert Scott, who represents the 3rd District of Virginia. He was elected to the U.S. House of Representatives in 1992. Through his election, Congressman Scott made history by becoming the first African-American elected to Congress from Virginia since Reconstruction, and only the 2nd African-American elected to Congress in Virginia's history. He is the chairman of the Subcommittee on Crime, Terrorism, and Homeland Security on the Judiciary Committee, and also is a senior member on the Committee on Education and Labor, and also on the Committee on Budget. So we're going to start with Barbetta Singletary, who will sort of give us an overview of some of the very important provisions that she had a role in implementing in the bill that we're so proud to present to you this morning.
Good morning.
Good morning.
I am Barbetta Singletary, the Policy Director for the Office of the Majority Whip. And I'd like to thank the Congressional Black Caucus Institute for inviting me to serve on this distinguished panel this morning. Bill Kirk, Angela Reamer, who are in the audience, who I have the privilege of working with. Thank you so much to both Representative Scott and Representative Christensen, who I worked with as we toiled to get the Patient Care and Affordable Act passed. If you recall, this time last year, all you would see on the news were people screaming at the members of Congress as they debated this bill and what it would mean for this country. And the news reports would lead you to believe that the day after the act was passed, that somehow this country was going to falter. And the day after we passed the bill, I looked around and I said, wow, we're all still here. What I'd like to do is just give you a brief overview of some of the more pertinent provisions that are included in the Affordable Care Act, some of which you may know, some of which you may not. So let's start talking about Medicare. I know seniors have been concerned about the various provisions in the bill and what it means to them. And as I said, reports would have you believe that we were going to have, dare I say it, death panels, and we were taking away people's health care at the expense, providing individuals health care and access to health care at the expense of seniors. What I'm proud to say is, through the provisions that we provided in the bill, the Medicare Trust Fund is going to be solvent for more than 27 years previous to what it would have been when we passed the legislation. But if you're a senior on Medicare, what this bill provides you is free preventative care. Now, one of the struggles that we had while debating this provision was getting the Congressional Budget Office